Welcome to Partners in Pancreatic Cancer. My name is Eduardo Bruera and I'm the chair of the Department of Palliative Care, Rehabilitation and Integrative Medicine at the University of Texas MD Anderson Cancer Center in Houston, Texas. My question today is keys to communicating with patients with advanced cancer. When is the best time to begin this discussion? We know that many cancers, including pancreatic cancer, are quite advanced very frequently early after the diagnosis. And it is therefore very important to start communicating with patients about their prognosis, about their diagnosis, about what's coming up as soon as possible in the trajectory of illness. It is quite known that patients frequently do not ask very important questions that they have in mind, and therefore helping them, sometimes even giving them prompt sheets in the waiting room about questions that come to mind is very useful. One of the problems that we have learned is that in general there is a trend to say we will have some conversations about prognosis, about end-of-life care, about advanced care planning once we try how the treatment is doing. But unfortunately, very frequently, by the time it's clear that the treatment is not doing very well, problems have already happened and the care is now very complex, and sometimes patients are even unable to participate in the conversations. Therefore, it's very important to have those discussions about prognosis as early as possible. Now, of course, many healthcare professionals are worried about decreasing hope in our patients and families. So at Anderson, we frequently have developed something that instead of being the goals of care, that is complex, because if you ask me my goals of care might be, well, doctor, make my cancer history, make it go away, and I might not be able to do that. Otherwise, the goals of care might be turn my cancer into a diabetes and allow me to live another 30 years, and sometimes that might also not be possible. Therefore, we developed the so-called goals of CAR, that is, the same goals that you have when you buy a car. In Texas, you always have to have a car. And therefore, the goals of CAR simply mean that when you buy a car, you have the best hope and expectations for your car. You want to take it for holidays and you're going to go to work. However, at the same time, you always wear a seatbelt, and when you leave it parked at the shopping mall, you lock it, and you also buy insurance. That's not because you are pessimistic or depressive or you need to have an expectation of your car being stolen, but on the other hand, you know those things happen. And therefore, we tell our patients that quality of life when you buy your car can be enhanced by knowing that you have insurance, that you wear a seatbelt, and that you lock your car. When we get a diagnosis of cancer, we encourage our patients and our healthcare professionals to do the same thing as we do when we buy a car. That is, I can have the most expectations about the surgery, radiation therapy, chemotherapy, targeted therapy, and even experimental therapies I will be getting. But the same as I do with my car, it's very important to have some conversations about what happens if I am not able to drive myself and I need somebody to help me. What happens if I'm not able to climb the stairs to the bedroom and I need some help? Who would live with me if I have difficulty getting out of bed? And finally, what would I like to have done if the end of life happens? And therefore, we can do those things and we can have those conversations without changing our expectation of success for our treatment. Therefore, it makes it possible for these discussions to start happening quite early as compared to after the treatment has failed. We tell our patients it's not going to be easy to get insurance after you crash your car or after it's been stolen. And therefore, it's very, very important to have these conversations when we don't really need them, so that they are there at the moment it becomes necessary to have them. I would like to thank you for viewing this activity. For additional resources, please be sure to view the other educational activities on partnersinpancreaticcancer.com. Thank you very much.